Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll discuss a very Polychrest remedy, but in a different condition, which normally we do not think in our routine practice. The remedy which I'm talking about today is Silicea. And you all know Silicea is a very important Polychrest remedy which is used in our practice day in and day out. But let me tell you some symptoms of Silicea which I have found useful in case of fever. So there are some cases where something the remedy does not work, and then you try to evaluate the case, and then this Polychrest remedy comes into play. In Silicea, the most important part of fever is present in the posterior part of the body. Patient comes and tells you the fever बहुत गर्म लग रहा है, मेरी पीठ बहुत गर्म लग रही है, पीछे के पैर काफी गर्म लग रहे हैं, in the posterior part of the body. This is again a very important symptom because this is a very defining symptom of that patient and the disease. In this respect, you must always think about chamomilla, Silicea is there, sulfur is there, and thuja is also there. So this again is a very important symptom of Silicea fever. Next, as you go and read Silicea, there is one symptom of fever which is again very, very useful, and that is mental exertion. Whenever the patient says that I have fever, whenever I am doing some mental work, when I am studying, whenever I am making some business plan, whenever I am exerting my mind, my fever increases. When I am lying down, no thoughts, nothing, the fever is absolutely normal. And this becomes again a very, very striking feature of Silicea, that is mental exertion aggravates the fever, or mental exertion and then fever follows. Think about belladonna, nux vomica, phosphorus, Silicea in these respects. So this again mental exertion aggravates fever is again a very, very important symptom which I have seen in my practice. And you must be knowing there are some fevers where the periodicity is very marked. The same day it comes, the same hour every day it comes, And we never think about Silicea, but if you see Silicea in the Mater Medica, it is written periodicity every day at the same hour the fever comes. And if this symptoms comes, normally we think about Cedron or Sabadella or Stanamide. But my dear friends, from next time do think about Silicea. It is a very, very important symptom which I have seen in many of cases of Silicea, where the periodicity is well marked. One more symptom of Silicea is the patient comes and tells you, मेरा हाथ बहुत गर्म लगता है बुखार के टाइम पे. Sometimes my head feels only hot, everything is fine. So fever in single parts. Now this is again a very important symptom. Fever in single parts. And as you go further, one symptom of Silicea which I have seen which I have seen in my practice and confirmed in so many cases, that is storm, in relation to storm. And whenever the word storm comes, the first remedy we think about is rhododendron. But next time, do think about Silicea. Fever, storm, before and during. Before the storm and during the storm, if there is fever, do think about Silicea. Very, very rare symptom, very, very important symptom, but very, very unique symptom of Silicea. And of course, a Silicea patient in fever has aversion to uncovering. That means he wants to cover. And in case of urethral fever, whenever there is infection in the urethra or something related to urethra and you have fever, do think about Silicea. Of course, in this you can think about Chinas, Hipparsa, Lachesis, Gelsemium, Meconite, but also think about Silicea. And before I close, normally when people have worm fever because of worm, we normally think about the worms remedies, like we think about Cinna, we think about Spigelia, we think about Sabadella, we think about sulfur. But my dear friends, Silicea is a very, very important remedy when there is a worm fever or fever because of worm. So these are few very rare symptoms, important and unique symptoms of Silicea which I have seen in my practice and prescribed with good results. So my dear friends, if you like this video, do share and subscribe. Thank you.